Good afternoon, my name is Rafael Sanjuan Cervero. Thanks to all the organizing committee for this opportunity to show our work in this International Dupuytren Virtual Symposium. We sincerely hope that the next time we can see and discuss our works in an ordinary meeting. This time we want to show you the Spanish translation of the URAM questionnaire for Dupuytrens. This work has been performed in the hospital of Denia in Spain. All the authors declared that we don't have any potential conflict of interest and we have not received any specific grant for this work. Usually, results in treatment of Dupuytren's disease are evaluated by range of motion. Range of motion gives us an idea of the correctly contracted, being a reproducible and objective way to explain the results. But is this well correlated with what the patients think about these results? Range of motion does not measure satisfaction of the patients or if the correction solves the need and requirements of every patient. These problems are seen in the major part of the other systems of gradation, measurement or staging that we can find at the web page of the Dupuytren's organization. So we need a system to make a system to differentiate the optimal results for each patient. For example, valoration of the results are different for blue-collar workers and white-collar workers. Residual flexion of the PIP at the middle finger is not the same for a farmer than a pianist. For this purpose, prompts were developed. Prompts are questionnaires for measuring quality of life and to capture the sensation of health or improvement if it's measured before and after the procedure in an effective and safety way. Prompts can be generic if they measure global conditions of a patient, region-specific if they measure, for example, the arm as it's seen in the DASH questionnaire, or disease-specific. In the last section, and in the case of Dupuytren disease, there are two specific prompts, the Southampton Dupuytren scoring scheme and the Unité Rhumatologique des affections de la main. URAM questionnaire was initially published in 2011, although was used several years before in Paris, in Lariboisière Hospital, where it was developed by Joan Bederwille. The importance of this center related to Dupuytren is that Lariboisière Hospital was one of the pioneer centers where the needle aponeurotomy was established as a first-line treatment. The advantage of URAM's respect to other questionnaires is that initially was developed to evaluate the status and results only in Dupuytren's. In other words, it was developed as a specific disease questionnaire. Since this point of view, our objective was to translate the URAM questionnaire to a Spanish version. You can see the initial published questionnaire in English version and the results of our work with the Spanish version of the URAM. For our work, we have taken in account the URAM like a region-specific questionnaire referred to head. In this way, we have been able to include patients with carpal tunnel syndrome to evaluate the questionnaire for these patients. Initial translation was made by 6 professional translators, 3 inverse and 3 reverse translations from original English version and our initial translation. 106 patients were included, 51 with Dupuytren's and 55 with carpal tunnel disease. All of them completed a form where they were included SF12 as a generic questionnaire, Quick Dash as a region-specific one, and the URAM before and after treatment. Quick Dash selection was made because its structure is more similar to the URAM than the long version, and it's more easy for patients to complete. For those who are not experts in statistics, we have to say that in these correlations, the importance of the result was determined by the statistical significance. In this way, although correlation it will be more or less weak or strong, the importance in statistics is that the correlation will be statistically significant. In Dupuytren's negative correlation show improvement in contracture decrease Thumbing effect is shown as an evaluation of improvement in treatment published by Dupuytren. In CTS, improvement was measured by clinical exploration and interview with the patients accordingly to the criteria established by REMPL. We can see that results for internal consistency, test-retest reliability, and responsiveness were excellent. If we talk about the use of the URAM in the literature, maybe the first time it was used was in an international study called Point X, made in Europe for the treatment of collagenase. We can see in the authors' index a Spanish group of investigators that probably used a non-validated version of the questionnaire. If the Spanish authors didn't use the questionnaire, it is not specified in text, so we could assume that the use of the Spanish version is not a validated version of the URAM. As you can see in the slide, the URAM is a very simple questionnaire. It consists in 9 simple questions that can be answered at the clinic, and it's very quick to complete by patients. At the review level, URAM shows an easy interpretation. It means that with only a quick view we can see if there are changes or not, and if these changes are important, for example, before and after treatment. Numerical valuation is very simple too, with a maximum puntuation of 45 points, being worse as far the puntuation will be higher. If we talk about other questionnaires, there is no actual consensus about which questionnaire is the best. Our group is working in this issue, but we have no results actually to show in this meeting. In other terms, we have to clarify that the most widely used questionnaire to assess results in Dupuytren is not useful for this purpose. DASH and Quick DASH are region-specific questionnaires used for multiple pathologies in the upper limb, for shoulder to head, but a special characteristic of Dupuytren's disease make it use controversial. Here you can see several of the potential drawbacks shown in different papers all along the literature of Dupuytren, referred to the use of the DASH and Quick DASH prong. Finally, we have to talk about the recommendations made by the International Consortium for Health Outcomes Measurement. In a recent published paper, actually in press, recommended prompt for finger pathologies is the Michigan Hand Outcomes Questionnaire. One of the problems of the Michigan is the use of reverse questions. This difficults quick evaluation and estimation of the results. Conversely, is a wide-use questionnaire in several pathologies, including Dupuytren's, and is hand-specific too. But this recommendation does not exclude the URAM on display. The ICHOM explains that it's necessary an evaluation of the recommendation to optimize the daily use of questionnaire at the clinics. And if we talk about specific issues, like Dupuytren's, things can see in a different way. In the report published by this association, no specific reference has been made for Dupuytren's disease, so we don't know if it's specifically tested or not in this paper. Finally, in conclusion, we can say that the Spanish version of the URAM is a reliable, valid, sensible and responsible tool to show standard measurements in patients with Dupuytren's disease. We could add accordingly to these results that for carpal tunnel syndrome too. Thank you very much for your attention.